Hello nurses all over the world. You're welcome back to my channel. My name is Nurse Felicia and I want to welcome you back to class. So can you guess what we'll be talking about today? Because today we're talking about type 1 diabetes. So that's what we'll be talking about today. Alright, so type 1 diabetes, once known as juvenile diabetes or insulin-dependent diabetes, is a chronic condition, and in this condition the pancreas makes little or no insulin. So, and we know that insulin is a hormone in the body that uses it allows sugar, that is glucose, to enter into cells to produce energy. So that's the work of insulin. I come again. Insulin is a hormone the body uses to allow sugar to enter into the cells to produce energy. So although type 1 diabetes is usually appears during childhood or adolescence, it can also develop in adults. So I want you to take note of that. It's common during childhood or during in adolescence, but can also occur in adults. Even after a lot of research that have been carried out, type 1 diabetes has no cure, so it has to be managed. So the treatment is directed towards managing the amount of sugar in the blood, thereby using insulin to combat that, then diet and lifestyle, just to prevent complications. Let's talk about the causes of type 1 diabetes. The exact cause of type 1 diabetes is unknown. Usually, the body's own immune system, this is how it happens. The body's own immune system, which normally fights harmful bacteria or viruses, they destroy the insulin-producing cells, which is, we also call it islet or islets. I don't know how you call it in the pancreas. So other possible causes are genetics and exposure to virus and other environmental factors. So those are the causes of type 1 diabetes. Let's talk about the signs and symptoms. The first one is feeling more thirsty than usual. So the patient complains to you, or you have somebody complaining to you that I feel thirsty, I just feel like taking water, drinking water. As much as water is good for the body, it's so important. Excessiveness of everything can be dangerous. So if somebody is telling you that he doesn't drink water every time, then you know that there's an alarm ringing. Another one is urinating a lot. Imagine somebody feeling too much of thirst and they want to take water, and at the same time they are urinating a lot. Another one is bedwetting in children who have never wet the bed during the night. Feeling very hungry, losing weight without trying, feeling irritable or having other mood changes, feeling tired and weak. And the last one is having blurry vision. So those are the signs and symptoms of type 1 diabetes. Let's quickly talk about the risk factors. The risk factors of type 1 diabetes include family history. So a family whereby there's history of type 1 diabetes, then everyone that comes from that lineage are at risk of developing type 1 diabetes. Another one is genetics. Having certain genes increases the risk of developing type 1 diabetes. And the last one is age. So type 1 diabetes can appear at any age. I said it during childhood, adolescence, and even in adults. But it appears at two noticeable peaks. The first peak occurs in children between 4 and 7, and the second one is between children of the age of 10 and 14 years old. So let's talk about, I want to talk about two important things in this condition that we're talking about. Let's look at the role of insulin in the body. So once a large number of islet cells or islet cells are destroyed, the body will produce little or no insulin. And insulin, I said it earlier, that is an hormone that comes, I said that it is an hormone that allows the sugar or the glucose to enter into the cell to produce more energy. So extensively now, insulin is a hormone that comes from a gland behind and below the stomach, which is the pancreas. And where do we get the insulin? It's from the pancreas. The pancreas puts insulin into the bloodstream. Insulin travels through the body, allowing sugar to enter the cells. Insulin lowers the amount of sugar in the bloodstream. And as the blood sugar level drops, the pancreas puts less insulin into the bloodstream. That is the role of the insulin that I want you to really understand. And now, the role of this insulin or the pancreas performing its function is compromised. So that is how we come about this type 1 diabetes. What is the role of glucose? That's the second one. Glucose is a main source of energy for the cells that make up muscles and other tissues. I believe you know that. Glucose comes from two major sources. One, food, and the other one is from the liver. Sugar is absorbed into the bloodstream where it enters cells with the help of insulin. So we can eat a lot of carbohydrates or sugar-giving food or calories, and at the end of the day, it builds up in the body as sugar. If the insulin is not being produced by the pancreas to allow those sugar or the end product, which is glucose, to enter into the cell, then there will be build up in the blood. And that is when you check the blood sugar of that individual and it spikes. So I want you to really understand this particular condition. So the sugar is absorbed into the bloodstream, like I said earlier, where it enters cells with the help of the insulin. The liver stores glucose in the form of glycogen. Yeah, I know when we're talking about the breakdown of carbohydrates, protein, all those things, I know you'll be familiar with what I'm saying here. And if you have forgotten, please refer back to your notes or your textbook just to refresh. When glucose levels are low, such as when you haven't eaten in a while, the liver breaks down the stored glycogen. So excessive glucose is glycogen, is converted to glycogen. And that is why I want you to know that when someone wants to do a fasting blood sugar, they will tell them that they want to do it in the morning. Because when you tell somebody to fast, and the person can, majorly for Christians or Muslims, everybody, if you want to fast and you are able to carry through the day because you have probably stored glycogen that is going to be converted back to glucose so that your cells have something to feed on, so to say. So if there is excess glucose in the body, it's converted to glycogen. So when somebody is going for fasting blood sugar, it is recommended that they do it in the morning, because when it's 12 p.m., what are you doing? Because the body would have used up the excessive glucose, which is glycogen, converted back to glucose, and is already going about the daily activities. Even though I have not eaten, I can still have more energy because I have stored glycogen in my body. I hope you understand this. So when glucose levels are low, such as when you have not eaten in a while, the liver breaks down the stored glycogen into glucose, like I've explained. This keeps glucose levels within a typical range. Yes. So in this type 1 diabetes that we're talking about, there is no insulin to let glucose into the cell, talk less of storing it or converting the glucose to glycogen. And you see that there is problem now. Because of this, sugar builds up in the bloodstream, and this can cause a life-threatening complication. And that will take us to the complication of this condition. Over time, type 1 diabetes complications can affect major organs in the body. These organs include the heart, the blood vessels, nerve, eyes, and kidneys, having a normal blood sugar level can lower the risk of many complications. So diabetes complication can lead to disabilities or even life-threatening conditions like heart and blood vessel disease. When there's excessive blood in the excessive sugar in the bloodstream rather, then there's risk of this blood vessels disease or coronary heart disease. Coronary artery disease with chest pain, which can lead to angina pectoris, heart attack, stroke, narrowing of the arteries, because when there's blood, when there's sugar accumulated in the bloodstream, then it narrows the artery. It adheres to the lining of the artery, making it to narrow the artery, and this leads to arteriosclerosis, and even high blood pressure can happen. It can lead to nerve damage, which is neuropathy. So too much of sugar in the bloodstream can injure the walls of the tiny blood vessels and can also extend to the nerve. Another one is kidney damage, which is nephropathy. The kidneys have millions of tiny blood vessels that keep waste from entering the blood vessel. So this diabetes can damage the system, and this severe damage can lead to kidney failure or end-stage kidney disease, which can't be reversed. Another one is eye damage. When there is excessive sugar in the bloodstream, blood vessels in the retina, that is the part of the eye that senses light, and that's what leads to blurry vision. And we can also call this diabetic retinopathy. This could cause blindness, and this can increase the risk of other visual conditions such as cataract or glaucoma. Foot damage. When there is nerve damage in the foot, then it can lead to poor blood flow to the feet, increasing the risk of foot complication. And this can at the end of the day lead to amputation. So I want you to take note of that. Skin and mouth condition. When sugar is accumulated in the bloodstream, it prones that particular individual to a lot of infection. Pregnancy complication can also be eminent in the sense that high blood sugar level can be dangerous for both the parent and the baby. And the risk of miscarriage, that is stillbirth, birth defects, which can be increased. Let's quickly talk about prevention. There's no way to prevent type 1 diabetes, but research has shown that working on preventing the disease or further complication or further damage to the islet cells in people that are newly diagnosed can often help. It's just like a lifetime management. Let's quickly talk about the nursing responsibility. So the first one is patient education. You educate patients on insulin administration, blood glucose monitoring, dietary guidance. So sometimes you can even encourage what do we call them? The people that manage from the kitchen in the hospital, all these dietetics. You can invite them so that they can give the patient a meal plan, and you can also teach the patient to recognize hypoglycemia. So you educate patients on recognizing symptoms of low blood sugar and how to respond to it. You can also monitor. The second one is monitoring and assessment, whereby you do vital signs, blood glucose level, and you also watch out for signs of complication. And the major signs of complication is diabetic ketoacidosis or hyperglycemia. That's the major sign of complication. So you monitor for that. You monitor for signs of complication, which is diabetic ketoacidosis and hyperglycemia. Then you also develop care plans. You collaborate with other healthcare team to create individualized care plan for this patient, and so that you can monitor this patient's specific needs and goals. So you want to manage patients individually. You set measurable goals for glycemic control, nutrition, and lifestyle modification. Another one is medication administration. So you encourage the patient to use their drug, to take their drugs. They prescribe insulin dose. You encourage patients to always take their insulin, and patients can also be educated on how to inject themselves. When they are discharged, you will often teach them how to inject themselves, and you also educate the patient on the importance of adhering to this medication regimen, their regimen. Then you give emotional support. I know it's not easy, but you also provide psychological support to the patients. You allay their fear, you calm them, and you also encourage the patient to go to support group counseling. They should come for counseling if needed, and you also do your follow-up care. Check on the patient from time to time, and you teach the patient emergency preparedness. You teach the patient who to call, when this happens, the signs that they are in the state of emergency. You let them know, and you educate them on the use of glucagon for severe hypoglycemic episodes. You do your regular follow-up. You promote lifestyle choices, and you also encourage the family involvement. Tell their family to check up on them. Probably you tell them somebody needs to be living with them. The last one is documentation, which is very, very important. You document everything you have done appropriately. All right, so we have come to the end of today's class on type 1 diabetes. I hope that you have been able to learn one or two things from this topic. And until the next time, I remain Nurse Felicia. Don't forget to subscribe to my channel, share, and also comment. Share your own thoughts about this topic, and any topic you want me to treat. Do well to let me know, and I'm more than happy to do that. All right, so till we meet again, I say bye.